Welcome to Markets Plus, where leading experts from across BMO discuss factors shaping the markets, economy, industry sectors, and much more. Visit bmocm.com/markets plus for more episodes.
This is Journeys to Growing the Good on Markets Plus, featuring intimate and inspiring conversations with visionary leaders, where we uncover their unique personal stories, strategies, and passions that motivate them to boldly grow the good in business and life. I'm your host, Issam Majeed. Imagine, for a moment, if your everyday clothing could monitor your health, detect early signs of illness, and even connect you to your doctor. Sound futuristic? In fact, it's already happening. Today, I'm honored to have on our show Tony Chahine, founder and CEO of Myant, a global leader in advanced materials, textile computing, and connected health solutions. Tony is an entrepreneur with a passion for solving some of the most pressing problems by rethinking and redesigning healthcare. His leadership of Myant combines his enthusiasm for disruptive technology with his extensive knowledge of problem solving in the consumer market. Tony, as the inaugural guest on our show, welcome, and thank you so much for joining us today.
Thank you. It's an honor for me to participate in this great idea.
I'd like to start with this idea of connection between people, technology, and health, which seems so central to Myant's mission. And before we get into the company's journey, can you tell us how the idea of connection influenced your early life and the community and environment that you grew up in?
Yeah, for sure. I grew up in Lebanon at the time. Lebanon was going through a civil war, and connectedness is an essential element of survival, where you're worried always about your family, your friends, your loved ones, your neighbors, and everyone is highly connected, because I lived through it for many years, where you just don't know what tomorrow brings. And, happiness, sadness, dealing with life was so much better when you are in the company of loved ones at every level.
And, I've heard you mention in the past that when you were growing up, your grandma was your AI, or your mom was your AI, and how they had this innate ability to instantly read off of you and kind of tell how you looked at any given time and if you might have been unwell or not yourself that day. My mom, I think, had the same superpower, and I'm sure a lot of our listeners feel the same way about their moms and grandmothers. Is that one way to think about this idea of connection with the community?
Yeah, absolutely. Like, if you look at technology in many ways is a form of digitizing. It can work very well when it digitizes current experience. For me, my mom, my grandma, my neighbors knew each other's pattern. I remember I was invited to a keynote speech at Stanford to talk about AI as it relates to, and what's the role of textile and AI and connectedness. And I've said, look, for me, AI existed many, many years back before when people started talking about AI. And I was asked, what do you mean? I said, look, in my community, the barber, the vegetable stand person, the teacher, I couldn't hide any secret because everybody knew what was going on. So if I decided to not show up at school that day, my grandma knew, and I knew the kind of trouble I will get into that evening or from my parents, because the whole community was connected. So for me, this idea of existing in a hyper-connected society was part of my upbringing. And I'm trying to think about how do I leverage technology to digitize that social experience I lived it in my past.
Yeah, no, I mean, my siblings and I had the same feeling with our mom, that there was no way we could escape a lie. And, we are in a world now, Tony, where society is increasingly hyper-connected and AI is expanding everywhere. Devices, ecosystems, robotics. How do you envision human beings adapting to these dynamics as far as their connection with AI?
Yeah, I think you are correct by saying we are living in a hyper-connected society. The only challenge that I see the level of connection between humans and that connected world is very shallow. So there is already a framework in place for connected devices. Some of those standards are referred to as Bluetooth, for example, or Wi-Fi, or sending data from one device to the other. In fact, there's also a protocol for autonomous mobility, how they communicate through satellite and radar and sensors in the car to other cars, etc. That framework is very well established and it works. The challenge that I see is a challenge how humans are going to participate in this hyper-connected society. I believe what's really important is to define a framework where human could participate as humans. I want a whole person to have an immersive relationship in that framework. So I want it to be a human-centric level of connection where spirituality, social determinant, income level, the entire modalities that we have, I want to be able to infer the five senses. And I think that framework, in my opinion, is a must for human to coexist in harmony in this hyper-connected world. It's going to take time, but that's something that I am personally, and the team that we have, we are envisioning that future. We're trying to make a difference. So for human to participate, it cannot participate in just an episodical connection, because you have to imagine this coexistence in harmony where humans are still to some extent in charge. So for me, I just want to make sure that we have a framework that allows anyone to participate, and the system has to allow for level of empathy and level of understanding humanity in order for this coexistence.
Well, Tony, that really helps set the stage as far as getting into the origin of Myant and what motivated you to form the company and pursue this venture, which I think it was really quite inspirational, but also has a very personal element to it for you. Can you share with our listeners what motivated you to launch Myant? Not just the problem you were trying to solve, but also the broader impact you hope to make on society.
When I started Myant, I wasn't at the beginning thinking of it as a company. Unfortunately, my late dad suffered a serious dementia at a very young age, shortly after my mom passed away at the age of 53. So my dad lost his companion, his best friend, the love of his life, and he was left alone. But when you put someone like my dad with a very serious dementia in a new community where there's no friends, no neighbors, and little interaction, because the entire neighborhood is like working, busy, no one is sitting at home, just waiting for a neighbor to knock on the door. So my dad developed this, and it accelerated very quickly. And it was very difficult for me to kind of figure out what's going on with him, because I grew up in a system where you're calling your parents every single day to check on them and to see how they're doing. And the symptoms grew very fast. And I wanted to find a medium to stay connected with him. And someone with dementia can't learn new habits, unfortunately. So I kept thinking about, what do I do? And it kind of clued into me that I've never seen him going outside naked. He did many, many weird things, but he never went outside naked. And I said, okay, well, why don't I research if I could find a way to make the polymer that is made in the textile, or the textile itself, the yarn, the material in the yarn, if I can make them electrically conductive, or I could use them as a sensor, maybe I could find a way to know if he has taken fever, or if he has, an elevated heart rate, or if he fell, or if he's lost, or if he had anxiety. So how do I make the underwear or a polo or a shirt or a pants transmit real time in a passive way, not in a way that my dad has to interact with something? I want something to be passive or ambient, to transmit dozens of data modalities from my dad on a near continuous basis. So now me and my sibling could figure out his well-being and what's going on with him. And from there, you can deal with things.
It's something that it's so relatable, I think, for so many of us with elderly parents or elderly loved ones. Before maybe we move ahead further, Tony, just for the benefit of our listeners who may be a little bit new to this field, Can you just quickly describe, some of these concepts when you mentioned textile computing or advanced materials? And one thing important for our listeners to understand, how does this technology differ from something like an Apple Watch, for example?
When I say multimodal data or a whole person, as described, what all of those mean, you need a whole person representation. And so, given that textile covers the body from top to bottom, it's the best candidate to be that medium. The goal was, how do you take the entire body modalities and upload that to the cloud for me and my siblings and healthcare practitioners to consume the data in the event my dad had an issue? The beauty about the textile is not just a sensing platform. It's not just measuring certain things. It's actually also actuating certain things. So if my dad was cold, it can heat them up. If my dad had a pain, it can deliver a therapy by way of electric stimulation. So as we evolve, we want truly to develop a textile-based interface that will mimic our human skin. So the human skin is designed to react to things. If you're cold, you shiver. If you're hot, you sweat. So the idea is, how do you develop an interface that is passive, that does not require an input from the user, that is the primary interface that allows for sensing and actuation? And there's nothing like textile that can do that, because we can have relationship between swelling below the knee and heart failure. We can have relationship between change in the biomechanic posture or gait of the person and cognitive disorder. Something like a wristband device cannot capture those things at a clinical level. We are not trying to do this just to have wellness score. We want to do this for diagnostic purpose in order to provide accessibility for the most vulnerable. So if you solve for the most vulnerable, you solve for the rest of the public.
Well, it's interesting you mentioned that, because I think one of the areas I was interested in hearing more about was how advanced materials and smart textiles can help deliver better health outcomes for all walks of society, including individuals in maybe less advantaged and more marginalized groups of society.
What needs to happen is a continuum of care. So if I take you back to the connectedness, in a small community, anticipatory healthcare was prevalent, was existing. You were able to tell when someone is about to get sick before they got sick. What AI needs to do is to predict sickness before you get sick. The question is, how do you do that? If you're going to rely on patient to tell AI, I'm not feeling well, I'm going to get sick, that's not going to solve the problem. You need an interface that's passively measuring data from the person on a continuous basis, like in a small town where everyone was part of that connectedness and everyone was able to see and detect early tells. It's about to say, how do I have a relationship with humans for the benefit of humans by leveraging AI and other benefit of technology by giving accessibility to anyone and any demographic and any income level. Leveraging something is very familiar to them, which shows textile, because textile cover 100% of the demographic.
Well, it's certainly incredible to think about the potential of textiles and AI, when it comes to ensuring proactive healthcare monitoring and moving away from more reactionary healthcare. Myant, Tony, is a company that, by its very nature and your vision for it, is taking the approach of building a new product category, as opposed to many other companies that take the approach of working, say, within an existing product category. So what unique challenges have you had to navigate as a company that's building a new product category? And how did you overcome them?
Thank you. That's a pretty important question. I wanted to do something that is very big, but very unique. So to do that, you can't just think about a Me Too product. You have to think about a new category. And really, the category that I felt through learning about what my dad went through is really a category of coexistence between humanity and machine. This concept of prevention and screening is not convenient, and it is not designed properly, in my opinion, because the system is designed around diseases, not around a person. I give you a small example. My dad had dementia, but also had heart conditions, but also had disc pain, but also had the hip issues. So imagine someone who has all of those comorbidities. They have now 4 or 5 specialists, and then he had to remove one of his kidney. So it's just a very complex issues. So for me, I just wanted to have a medium made of familiar material that is beyond a B2 product that can enable a new category. It's a presence that is equivalent of a physical presence, but it's a digital presence that allowed for inference of the 5 senses. That's for me the category I'm after. It's the advanced materials, the textile, the solution that we have are all element of that category.
When you're building out a new product category, I can imagine that the timeline to achieving your ultimate desired outcome can be much further out than many companies working within an existing product category. So, as a leader, how did you keep yourself and your staff and your employees motivated throughout all those years on achieving your end goal? Because all of us, and I'm sure our listeners can relate to this, by our very nature, desire fast outcomes and quick results and immediate payback. So what kept you driven and focused on the end result throughout all those years?
I want something special that has a global reach. When I saw what my dad went through, I made a decision that I only want to build a category that's relevant to the following mega trends. So I kind of settled around the following things. I saw that there is an environmental challenge, but I saw that early on. The other mega trend I saw is advanced manufacturing, where you can't make product relying on labor because you can't scale. So how do you create new type of manufacturing to really develop your idea? The other mega trend that I saw is everyone was talking about this Society 5.0. Japan launched it in 2016. What I saw, similar to what I saw in the case of my dad, to participate leveraging advanced materials that are PFAS-free or environmentally safe, to leverage advanced manufacturing, to create a system that allow human to participate with AI and robotic and autonomous mobility, or in another word, hyper-connected society, that forced me to think in a long term. And that require a lot of tenacity. So you have to map out those things, and you have to anticipate the ups and downs, the rejection, the lack of financing, and that you're alone in many, many of those experiences because you don't have a reference point. Me and my team had to do it from scratch. Every aspect of what we did is from scratch. The advanced manufacturing, we invested in machinery that was the wrong machinery in the beginning. Then we invested in new machine that turned out to be the right machinery. That was hell. And, I was very fortunate that I had people that were very loyal to the cause and very loyal to the company. It was really thankless job because no one was able to see the benefit in real time. And when you're working in an environment where everybody could kind of realize on their dream in like 6 months in some of those startups, I was alone with my team that they couldn't see anything. Like we were trying to build something to enable a new category and stay away from short wins, because sometimes when you have short wins, although it's enticing, you end up taking your culture into that commodity business as opposed to the long-term plan. So it was very, very still difficult to some extent.
That's such great insight. And, on that note, Tony, I can imagine there must have been some very difficult conversations in the early years when some difficult meetings and challenging feedback. But are there any particular milestones in Myant's history that you're especially proud of, where you felt some validation that your vision for the future of healthcare and Myant's role in that future was was taking shape?
When we start filing patents and companies start calling us, we can imagine me, this immigrant who came to Canada and had this idea, and then locally nobody believed in it. And all of a sudden we have companies such as Mayo Clinic, Otsuka, the largest conglomerate of pharmaceutical companies, are working with us. It was like mind-boggling. Honestly, we will sit together as a team and we will say, is this for real? It was crazy. Between 2012 and 2016, we couldn't get one shred filed because people didn't understand the level of innovation that we're doing. They thought, okay, we're just sewing some T-shirts and some tank top. But other people understood, and it really helped us.
It's interesting you mentioned that. I feel like so many innovations in the world that have really changed society, initially were very misunderstood. And a lot of people didn't understand what they were and thought those ideas were, just far-fetched, but they ended up, revolutionizing the world. So that really it's a tremendous story, your experience. And, as you know, 2 years ago, Myant acquired the Xerox Research Center of Canada, now known as Myant X. I've had the pleasure of touring the facility, and it's truly an incredible facility with groundbreaking technology and leading edge capabilities for innovation and product development. Certainly something, Tony, you can be very proud of in your team. How did that acquisition help to accelerate Myant in its mission? And was the opportunity to acquire the Xerox Research Center something that you went back and forth over for some time in your mind? Were there any nerves at all in making that decision? Or was it something you felt very confident and comfortable and sure of in pursuing?
We set ourselves from the beginning to intersect those three mega trends I mentioned. So the decision for me was really important because I wanted to leverage advanced materials, and since it has been a huge benefit to us. But was I afraid? You bet. I remember after I signed the deal, I went there on the weekend alone. And I'd never had the opportunity to tour it alone. I've always had people with me. And I have to tell you, I had shivers in my spine. I was so scared and overwhelmed by the sheer responsibility and the task. It's like you're talking about 170,000 square feet facility, $200 million in equipment. But, look, it's one of those things you have to do if you have the conviction to get to where you want to go.
Absolutely. I think every leader or executive or entrepreneur is faced with moments where they have to make a decision that could potentially, fundamentally alter the trajectory of their business, but they know that there's risks. And especially in this environment, where there's so much uncertainty around tariffs and macroeconomic and geopolitical uncertainties, it's definitely a common theme that we're hearing in the market from many companies and businesses that there's this hesitation on making key business investments, or expenditures, even where the potential reward could be meaningful. So I think it's very helpful to hear your story and what you went through before going ahead. And it certainly has had such a profound impact on your business. Shifting gears a little bit, I am so excited to get your views on trends shaping the new global economy and Canada's role. What role do you think Canada can play, not only in the global economy, but also in improving societal outcomes for citizens across the world? And what can Canada do? What steps to enhance and leverage its own capacity for advanced manufacturing and innovation and productivity?
What's really important, in my opinion, is to develop a framework that Canada is the ecosystem owner of that framework and leverage all Canadians, makers and innovators, whether it's in AI or in health or in mining, in whatever, into a framework of interoperability to deliver relationship between humans, health, human and work, human and society, human and mining, human and animals, human and food safety. And I believe wholeheartedly Canada has the highest possibility in owning that framework. So if you go to Africa today with the healthcare system, let's say you have the best EMR system, You're just another commodity. You may be displaced tomorrow by another company for a cheaper price. But if you go with an outcome, meaning delivering the best outcome through all of those steps, and that's a framework sign made in Canada, in my opinion, very few will be able to compete with that. And as a result, it unites and consolidates idea makers, innovators in Canada to subscribe to this framework so we can all coexist as economy makers into a framework where we all play our part and we can all grow together as Canadian makers.
Well, that's very profound, Tony. And it's great to hear that leaders and entrepreneurs like yourself in the Canadian market are thinking so holistically and so long-term about the potential that Canada has, not just within Canada, but the difference that Canada can make across the world. You know, if you could look back and speak to Tony from 2010, who was just getting Myant off the ground, or younger Tony, who was just starting out his entrepreneurial journey, what advice would you give?
I will say, if I can go back and pay attention way more to my communication, to my relationship with my stakeholders, and make them a partner in my journey as opposed to a transaction in my journey, I would say that will serve me way better today. Today, I'm 60 years old. When I came to Canada, I was 25, and I started a business within 3 months. And I've had successes and failure.
Well, it's interesting, that's advice that I think not only is relevant to younger Tony, but I think even more generally to other leaders and entrepreneurs, whether they're trying to disrupt an industry or just uniquely differentiate their product or service from others within an existing industry. I think that's really relevant to all sorts of leaders. What's next, Tony, for yourself and Myant? And where can listeners look to learn more about Myant and its products and technology?
For me, what I'm focusing on right now, we have 10,000 patients in Canada use our screening and assessment textile in cardiology clinics. I will tell you, it brings tears to my eyes when I know many elderly people who were diagnosed with hidden diseases using our device. I can't explain it. How the benefit and the rewards that you have, imagining that you're making money, you grow in a business, and at the same time, you're having tangible societal impact. The biggest reward that I honestly come to and I see is when patients use our product. So going back to what I told you about Xerox and our material science, we develop material science that meet the cytotoxicity level, biocompatibility level, that is compatible with human skin. So as a result, you can put it in any type of skin and enable a longer range study and develop societal impact because you're detecting chronic condition that could be deadly. Many of the patients that use our product were told by the clinic to rush to a hospital as a result of the clinic seeing real-time data enabled by our platform, which otherwise you don't have. So what's next for me is I just want to see a societal impact by scaling what we have and developing access to the millions of Canadians today who don't have a primary care, never mind specialty care. So I'm at a tipping point after 16 years. Now we're going to start growing more diseases and more coverage of the body using textile. So I'm super excited about our future.
Well, it's been an incredible journey so far. It's so exciting to hear this fantastic Canadian innovation and technology being exported, around the world. And I suppose listeners can go on Myant's website as well if they'd like to learn more. This, Tony, brings us to the final topic and something that we will pose to every guest on the show. So as you know, Tony, growing the good is our foundational theme on the show and the very purpose we're driven by at BMO, how we engage with each other, our customers, and the communities we're so proud to be a part of every day. So with that said, Tony Chahine, as the very first guest to ever answer this question, what does growing the good mean to you?
Growing the good for me is leaving no one behind. The biggest thing I want to do is enable peace of mind in every family. I want to enable a network effect of doing good. I want the family to start doing the following: manage their loved ones' care, leveraging the continuum of care that we are talking about. At the same time, make them participant early on so they can really see how their behavior could really impact their health, so we can enable longevity and quality of care for everyone. And maybe a smaller segment, doing good is also, I think, if we show a level of success as a category and as a company, I pray that other entrepreneurs and other dreamers and other inventors don't give up too early, to start understanding that doing good together has a significant benefit to the longevity of Canada.
Well, I think that's a fantastic and really inspirational note to conclude on, Tony. It's been such a pleasure chatting with you. Thank you so much for joining us today on Journeys to Growing the Good on Markets Plus.
Thank you so much.
Thank you as well to our listeners, and stay tuned for details on our next episode to be coming shortly. Until next time, I'm your host, Issam Majeed.
Thanks for listening. You can follow this podcast on Apple Podcasts, Spotify, or your favorite podcast app. For more episodes, visit bmocm.com/marketsplus.
The views expressed here are those of the participants and may not necessarily represent those of BMO Capital Markets, its affiliates, or subsidiaries.
For BMO disclosures, please visit bmocm.com/podcast/disclaimer.